Today we're going to learn about the Admit Navigator tool and MedRec at admission.
Medication errors are common and dangerous, even at our own institution. In fact, using traditional CPRS, we found that medicine teams in Ann Arbor had a 24% error rate at admission. However, using the Ann Arbor gold standard medication reconciliation process that you are about to use, the silver team was able to reduce their error rate to 6%, a relative risk reduction of 75%.
It's not surprising MedRec is so difficult at admission. I learned when I was a resident that CPRS is really not well organized to perform MedRec. You have to compare medications in the inpatient, outpatient, and non-VA tabs. If the patient has a remote medication, you also have to look in VistaWeb or Joint Legacy Viewer. The idea for the Navigator tool is that it will bring in all of these different medications into a single master list that is well organized by indication, so all your pain meds will be listed together. Finally, the tool will allow you to work together as a team to complete MedRec at admission.
Meet your inpatient MedRec team. This includes your inpatient pharmacist, ER pharmacist, and care coordinator. You'll be working together to make MedRec as safe as possible.
Please consider the bigger picture. By doing your part at admission, you are helping your colleagues down the road. Your pharmacist will be using your work to check for errors. The tool will help get us back to a 5-star facility by improving our quality metrics. And ultimately, your work will ensure the patient has a completely accurate, patient-friendly medication list at discharge.
MedRec at admission is as easy as writing your note using the new tool, ordering your medications in CPRS, and then double-checking your medications.
You will be writing your H&P note and performing MedRec using the new Admit tool. To open up the tool, go to the Tools menu of CPRS and select the Navigator tool. This is what the tool looks like. It is essentially a web-based tool that will allow the team, the residents, students, and pharmacists, to collaboratively complete the H&P note. I hope you actually enjoy using the Admission Navigator. Soon, the tool will automatically populate sections like past medical history, and you can simply review and update. It will also automatically bring in data for vitals, labs, and studies. This means less copy and paste. It also incorporates the MedRec tool for admission. The Admit note will be one of many possible notes that utilize the Navigator tool. The hope is to create a Wikipedia-style format where we all work together to keep the most up-to-date patient information in a centralized location. Here you can see that the past medical history was reviewed by another doctor. You can choose to accept and edit or clear this information. There are 3 steps to complete on the MedRec tab of the Admission Navigator. Steps 1 and 2 can be done by either the ER pharmacist or the inpatient team. Step 1 is simply to document the source of information for the pre-admission med list.
If you do find out that the patient is taking a non-VA medication, it is best to enter a non-VA medication in CPRS and click Refresh to bring the medication into the tool.
Step 2 is to decide if the patient is taking the medication. You may answer yes, no, or not as prescribed. If you would like the ER pharmacist to do steps 1 or 2 for you, simply give them a call. If you don't have access to a computer at the patient's bedside and would prefer to use a paper version, you can click here.
This is the printed version. You can use it as a template for ordering your initial inpatient medications.
MedRec is a great opportunity for medical students to learn. Don't hesitate to send them to the ER to do the initial MedRec and enter info into the tool for you. You can review it and provide them feedback.
In step 3, you will decide what to do with each medication. You may select Continue, Change, Hold, Stop, or Omit from the list.
Warning: I want to make sure that you realize that the tool is unidirectional. If you discontinue a medication in the tool, you will also have to discontinue it in CPRS. After you complete your inpatient orders, your final step is to double-check your work. Once your orders are complete, you can double-check them by clicking on the Double Check button. This is the Double Check screen. You can see it brings the medications into these 6 different columns, essentially summarizing what you did with the patient's medication at admission. The tool will point out potential errors such as ordering a medication you said you were going to hold. It will also check for unintended dosing discrepancies between the outpatient and admission orders.
The tool will also calculate an accuracy score. If you do well enough, you just might become a MedRec champion.
Congratulations, you have now completed your MedRec and H&P note. You can copy the note into CPRS using the Copy to Clipboard feature. I know this isn't easy, and I really appreciate you taking the time to make MedRec as safe as possible. I'm open to changing the process if you think something could be done in a better way. If so, just shoot me an email.